My name is Jacqueline Patrick.
And what's going on? You're here to support the workers here?
I'm here to support the workers at the Hospice East Bay because they're in a fight with the employer that is greedy, that doesn't respect families and respect the work that they do. The hospice workers are in the life care, and they are there to support families, to support the person that is passing away. And they need to be respected. They have families to take care of. You have to have a big heart to do this kind of work, and you need to be taken care of. As a healthcare worker, healthcare should not be an issue. I take care of patients every day, and I shouldn't have to worry about if I can afford healthcare, because if I'm not healthy, how can I take care of my patients?
And the UC management and regents have been imposing healthcare cuts on AFSCME. $32.99, they're in negotiation for a contract. They actually increased their cost of health care for these workers who are basically struggling to survive in the Bay Area. What does that say about what's going on at UCSF?
It means that UCSF is very greedy. They are billionaires. They are greedy on the backs of the workers. The workers work hard to take care of the patients, and they should take care of us.
And the right of workers to have their own union, isn't that a basic fundamental right for workers to be represented by who they want to be represented?
Absolutely. We voted to be in NUHW. We had several votes because we were in another union prior, and we voted, and then other groups voted to be in our union. So everybody that's in NUHW at UCSF Oakland has voted to be in the union that of their choosing, and UCSF has chose to put us in the union that we don't want to be in.
And what are the other unions saying about that?
Well, I had a little conversation with a few of them on the first day, and they said they were there to help us. And so I asked them how did they feel about their job, UCSF union busting, and they don't like it either. I just don't believe that they like it either, but I really don't know because I don't have that type of relationship with them. But it has to be heartbreaking for any union to know that an employer would just come in and take the employees and give them to a different organization just to get rid of the union, and that's exactly what they did.
And apparently UC is spending millions of dollars on lawyers, union-busting law firms to fight the unions. What do the people of California should do about it? I mean, it's supposed to be a public institution for working people, yet it seems like they're spending a lot of money to fight the workers and fight the unions.
Yes, they're fighting the workers, they're fighting the unions, and the people in California need to pay attention, because if they did it to us, they'll do it to you. If you are on a job and you're in a union, what they'll do is they'll just take all of your employees and give them to another company and then lease them back to the original person, and nothing's changed except for all of the things that you fought for in your contract will be eliminated.
And so they put you in another union. What's the new union they put you in?
AFSCME. I believe it's called AFSCME. I'm not really sure.
So you're a member of AFSCME now?
Yes, I'm a member of AFSCME now, against my free will. Well, it's not against my free will, because if I want to work there, I have to be in that union. But that's not the union I voted to be in. And
are you going to be going to AFSCME meetings and talking about this?
I had a brief conversation. I'm open to conversations.
Okay, and what can people in California do? Because we should have public health care. It seems like UC is really driving towards corporate mergers. They have money to take over hospitals. They're spending billions of dollars on new hospitals, but the workers who take care of people at the hospitals are being attacked. Yes, we are being attacked. Our families are being attacked. We're taking home hundreds of dollars less a month, and if you could imagine that somebody took hundreds of dollars out of your check and you weren't prepared for that, now you can't feed your family. Maybe you can't even pay your rent. Until we have universal health care, I think that the corporate billionaires need to take notice that the people are suffering. They are making us suffer. Well, Gavin Newsom is an ex-officio member of the Board of Regents. Have any of these people who are on the Regents or any politician said, no, you stop the union busting, you have a right to belong in whatever union you want to be in? Well, I'm not absolutely sure who said what, but we've talked to plenty of people that think that this is wrong, that it's not a good decision. We went to court and the judge didn't see, he kind of sided with half of us, and he
decided that maybe we shouldn't be able to go to arbitration, but it's a long story. But the fight is still, I'm here to fight, and the fight is not over. I'm not going to stop fighting until the judge says there's no more fight to do. Because I chose to be in this union, that is my choice, and until somebody says otherwise, I'm in UHW.
Well, AFSCME and UPTE have been fighting for over a year for a contract. Without a contract, they're attacking them. They're taking away the right to even pass out flyers, to act as a union. Is it a threat to all of labor at UC?
I believe it is. I believe if they get away with this, that what the companies will do is, because they have meetings. All the hospitals have meetings. There's Kaiser, there's Sutter, there's Stanford. They have meetings and they strategize against the workers. What they do is, I think what's going to happen is they get away with this. Kaiser will take their employees, give them to Sutter, make them still work at Kaiser. Sutter will take their employees, give them to Kaiser, and then they'll still work at their same job, and that will get rid of the union. They're going to choose the union that you are in because they're going to choose the union that will lay down and do nothing. NUHW will never, ever lay down. They will never, ever give up. We will fight.
And it seems like all this money that's going into healthcare, the healthcare companies, is not going to the healthcare workers. It's going for the profits. The single payer, I mean, it seems like these insurance companies are an obstacle really to get decent conditions for the workers and for the patients.
Yes, I think if they had single payer, we wouldn't be going through this a lot of times, because it's healthcare. Our healthcare is very expensive. It's too expensive to, now we pay for medical, we pay for dental, we pay for vision, we pay a portion into our retirement. We didn't have any of that at Children's Hospital. And Children's Hospital is a small hospital, we do understand, but we serve our community. We serve our patients. We serve the East Bay. We love working at Children's Hospital in Oakland because we are a community-based hospital, and I think that they're trying to eliminate us.
I'm Laura Nakamura. I'm the Vice Mayor in Concord. I represent District 5. I'm also a union steward with NUHW and a healthcare worker at Children's Hospital Oakland.
And I covered this strike there of your union there, and the issues of democratic rights of the members to be in the union they want to be in. What is going on at UCSF, at Children's Hospital?
It's a money grab. I was going to say it's a power grab. It's about money, and for us, it's all about patient care. And they're union busting because of what they call an integration. I call it a hostile takeover. They are breaking up the union with NUHW at Children's Hospital, and so that UCSF can absorb us.
And one of the benefits that you had as a union at Children's Hospital is free health care.
Yeah.
Now, the other workers at UCSF, AFSCME, UPTE, UAW, the nurses, they don't have free health care. Do you think that they were afraid that this movement for free health care would spread?
It's disturbing. And I will tell you, about 2 weeks ago, I went to refill my prescription for my blood pressure meds, and my payment was denied. And because of the transition, my health care card wasn't operational, so I went a couple days without a.
And the issue of democracy, the rights of workers to have their own union.
Yes.
What happened to that?
Well, if you ask NUHW, it's still going strong. We are a very democratic union. We are really strong. We believe in making the decisions from the ground up, and it's a great, strong union.
And they forced this merger, corporate merger, basically.
Yeah.
But the other unions also don't have contracts. UPT CWA, AFSCME 3299, UAW, and the nurses are negotiating for a new contract. Why aren't all the unions working together and have a united front? It seems like they face the same attacks.
Right, and I can't answer that. There have been questions in my mind as to why we weren't joined by the others on the strike line. AFSCME.
And the other issue is the corporatization of healthcare, because although UC says they can't provide benefits to the workers that they have been, they're buying hospitals, St. Francis and St. Joseph's in San Francisco. They're spending billions on new hospitals. You think UC is really basically trying to compete with other chains, and basically it's a corporate competition that's not benefiting really the workers and the patients?
And again, that's not a question I could answer. It sounds like what you're onto something there, but for me and for the people who do the work, it just feels like they're building profits off of our backs and our labor. And
so they want to make it a profit center, and your union was getting in the way, and your contracts were getting in the way.
Yes.
Increasing their profits.
Yes, exactly. Yes, we were taking a piece of that, and what disturbed me today about being out here is to hear that in this most recent contract, actually they don't even have a contract. They're being offered 0.5%. And to me, that is disturbing when you realize that the cost of living, the inflation rate right now is about 2.7, 2.8. And we know that people are having a hard time paying the rent and paying the bills. One of the things, just to switch back to what's happening at Children's, those costs that we're talking about, the additional healthcare costs and other things that they want us to pay for, we were told that our baseline pays wouldn't change, but our take-home pay at the end of the day, after we pay for the health care that they want us to now pay for, which is crazy because we're a part of a healthcare system.
You're healthcare workers, and you're paying for your healthcare.
Yes, exactly. So the take-home pay, and if you think about any of the employees who are working or living, if you think about employees who are living paycheck to paycheck, this is going to be a drastic change with what is happening, making the bills, paying the bills.
And I understand they can move you around, force you to go to other hospitals at UC system?
I haven't heard that. We are concerned about that. Yes, there is a concern that that's going to happen. There is a concern for me that people who may be traveling further to go to San Francisco for their jobs now have more seniority over us because our seniority's been stripped, and that they will come and get our jobs in the East Bay. And the people in the East Bay are the ones who have been taking care of our East Bay patients, and we know our patients best.
And where is the government on this? Because it's a Democratic legislature, they have, a supermajority. You have a governor, Democratic governor, who says at one time he supported single payer. What's happening? Because it seems like this cutback in Medicaid and the attack on Medicare Advantage has really threatened the entire healthcare system.
Yeah, I would like to know why it is stalled. It's something that we need. Universal single-payer health care is something.
The money would go for the workers and not the insurance company.
Exactly. Well, then you kind of figured out where the obstacle is, right? by mentioning the insurance companies.